Hello, I'm Jawad. I'm Exec Medical Director at East Lancs NHS Hospital Trust. This is my update. I'll start today on our clinical strategy. Now, ELHT has a number of strategies which basically feed into the overall strategy of the organization. And one of the supporting strategies is clinical strategy and quality strategy. These are the two which I'm personally responsible and involved with. Clinical strategy, as the word says, clinical is all about the clinical delivery of services. Now, we started the process by involving everybody who is at the forefront of delivering that. Our divisions, our directorates, our colleagues working in there. We had a strategy the last 5 years. Thankfully, we've delivered majority of what we said we would do, and we have now formulated a strategy which will take us into the next 5 years. Again, it's important that this clinical strategy is not in isolation of ELHT. It's in partnership with our colleagues across the region. It will deliver on a patient-centered care. It's not about just what ELHT wants to do, it's what is right for our patients. And that involves participation of groups who are very vital in delivery of the care. In the coming few months, there are engagement events where this clinical strategy will be refined, and we very much hope that by May of this year, we will have the trust board signed this strategy off so that we can get into action how we will deliver it over the next 5 years. This clinical strategy will also tie in with what the NHS long-term plan on delivery of healthcare is going to be. So I'll keep you updated. The next thing I just wanted to bring to your attention is about organ donation. Now, life is very precious, and when an individual comes to an end of life, there are things the families and the individual can do for people who need organ and tissue donation. There are lots of people out there who require an organ or a tissue donation, and their longevity and quality of life depends on this generosity. People have had organ donation and have then lived a normal life. So you can understand how it brings the joys to not only that individual, but their loved ones. We have recently unveiled a mural done by our local artist in Blackburn, and that just reflects on how organ donation and tissue donation bring joys to individuals and family. So it's a request to consider it strongly, and see how you and your families can contribute to the lives of others who rely on organ and tissue donation. Finally, I just wanted to bring to your attention that 2 years ago in March, we had our first patient of COVID. Unfortunately, that individual did not survive. So in the coming few weeks, we will be having a ceremony of reflections, a moment of getting our thoughts together and our experiences. So please share your stories, whether you are a member of this organization, a member of the community, or a member of health partnerships with our communication team. It would be nice and good to hear from you of how you managed to cope and what the reflections and learning was. It will be a somber moment for us. Every individual in ELHT, in our community, and with our partners in delivering healthcare have really worked hard to deliver what we feel is the best for our patients in these very difficult times. Look after yourself and look after your loved ones. We'll see you in a week's time. Bye for now.